Module 1 Normal Pregnancy. In this film of normal pregnancy, we will learn about the following: importance of antenatal care for safe motherhood, services that a health worker should provide to a pregnant woman, counselling for danger signs, informing a pregnant woman when to return for follow-up visits. The care of an expectant mother is called antenatal care. This checkup is done at regular intervals during pregnancy to ensure that the mother and baby are both in good health. This helps in timely detection of complications in the expectant mother, such as anemia and high blood pressure. It also helps to detect any slow or insufficient growth of the fetus. The antenatal care or ANC checkup also helps the family prepare a proper delivery plan and identify the appropriate referral facility so that mother and child can both remain safe. Women also need counselling during pregnancy.
Please sit. What is your name? Jyoti. Is this your first pregnancy?
Always maintain a friendly attitude during the ANC checkup. Listen to the problems an expectant mother has with attention.
Are you facing any problems now? Any discomfort?
After this, ask the expecting mother about her last menstrual period or LMP. Remember, this date is the first day of her last period. If she is unable to recollect her LMP, use references of any important local festivals or the last ANC checkup to help her remember. LMP is used to determine the age of the fetus or the gestational age and to fix the expected date of delivery or EDD. For a pregnant woman with an otherwise normal period cycle, the LMP formula is simple. EDD equals LMP plus 9 months plus 7 days. For example, if a woman's LMP is the 1st of January, then her EDD would be 1st October plus 7 days, that is 8th October. Collect information about past pregnancies.
Have you had any miscarriages? So this is your first pregnancy and you have had no problems till now?
If the woman has had an earlier pregnancy, check if she has had any of the following: APH, eclampsia, PPH, obstructed labor, and cesarean section. Check for any personal or familial systemic illnesses at this time.
You don't have high blood pressure, do you? Good. No diabetes? You've never had TB, have you? You don't suffer from breathlessness or palpitation, do you? Does anyone in your family suffer from any of these conditions that I asked you about? No one, right? Good.
The physical examination can be done now. This activity will be repeated at every antenatal visit. So remember to keep a proper record and compare findings. If any of the parameters indicate the need for referral, do so without delay. Also, check for signs of thyroid enlargement. The next important task is the examination of the abdomen and breasts.
Jyoti, please pass urine as we have to do your abdominal examination. Also collect a urine sample in the bottle. Please keep the bottle inside. Now we will examine your breasts and abdomen. Let's go inside.
The breast examination can reveal the condition of inverted nipples.
Jyoti, please lie down.
आराम से.
I must examine your abdomen. I need to lift up your clothing.
Now you can estimate the gestational age through the fundal height.
We will now measure the fundal height. The most important thing to remember is that when the height is at the line that passes through the umbilicus, the fetus is 24 weeks old. Divide the area from the umbilicus to the symphysis pubis into 3 equal parts. For instance, this shows the first part. This is the second, and the third line is on the symphysis pubis. So we divide this area into 1, 2, 3 parts. Similarly, we will divide the portion between the umbilicus to the xiphisternum into 3 equal parts. This is the first, this is the second, and this is the third. Let us find out how many gestational weeks each line indicates. At the umbilicus, the fetus is 24 weeks old. At the symphysis pubis, it shows 12 weeks. At the next line above it, it is 16 weeks. At the next, 20 weeks. And we have again reached 24 weeks at the umbilicus. At the first portion above here, 28 weeks. The next one is 32 weeks. And finally, 36 weeks.
Let us return to our earlier example of the woman who had her LMP on the 1st of January and her EDD on the 8th of October. If you were examining her on the 1st of April, her period of gestation on that date would be 3 months or just over 12 weeks. At this stage, the fundal height should be just above the symphysis pubis. As the pregnancy progresses, this will be higher and higher.
After 36 weeks, the fetus descends a little into the pelvis, and this line shows 40 weeks. At 40 weeks, the fundus seems a little lower than 36 weeks, but the difference is that, unlike earlier, the flanks are now full. This is how fundal height is measured.
Assess the presentation of the fetus by performing abdominal grips.
Now we will see where the baby's head is, where the buttocks are. Okay? Let's first see which part is on top. The top is soft. So these must be the baby's buttocks. Now let's check the sides. The baby's limbs are on this side and the back is on this side, and the buttocks are over here and the head is at the bottom. Okay, good.
During the first pregnancy, fetal movement can be perceived from about 20 to 22 weeks. In subsequent pregnancies, it can be felt a little earlier, around 18 weeks or so.
Jyoti, let us check the heartbeat of your baby.
Fetal heart sound, or FHS, is heard only after 24 weeks of gestation. To hear this, a fetoscope is used. If the fetal heart rate, or FHR, is less than 120 beats per minute or more than 160 beats per minute, the woman must be referred to the medical officer. Finally, ensure that the urine is tested for sugar and proteins and blood for hemoglobin.
Before you leave, I have some important suggestions for you.
Counselling the mother-to-be and her family members is a very important part of antenatal visits.
The importance of nutrition is even greater now. If you were eating 3 times a day earlier, now you must eat 4 times. Once in the morning, then during lunchtime, and then in the evening around 4 p.m. and then at dinner time. Between these full meals, you should also take snacks like roasted black gram, peanuts, and stuff like that. It is very important to get adequate rest during pregnancy, so please help her during this time. She must rest 2 hours during the day and at least 8 hours at night. You must get antenatal checkups done 4 times. You must get 2 doses of TT injections. And you must get other regular tests like blood pressure done. You must take at least 100 tablets of iron folic acid. One more thing you must know: danger signs during pregnancy. Continuous headache, blurring of vision during such conditions, you must rush to the hospital. Bleeding during pregnancy, abdominal pain, and finally, if you have an episode of fits, you must rush to the hospital if any of this happens. Institutional delivery is safe delivery. So you must plan in advance which hospital you will go for delivery, and you must keep the number of the ambulance or vehicle driver handy. After the baby is born, you must breastfeed him. Breastfeeding is a very important practice. It has a lot of value. It protects the baby from many diseases. The sooner you begin breastfeeding, say within 1 hour of birth itself, the sooner the baby learns to breastfeed. So breastfeeding is very important. It protects your child from several diseases. One more thing I want to tell you about caring for the baby. You must not apply anything on the umbilicus of the baby. You must keep it dry. This way it will stay healthy. If you apply anything on it, it could lead to infections. One last important thing. You must keep at least a 3-year gap between 2 children to ensure the health of both mother and the baby. You can select any family planning method after delivery to ensure this, such as copper tea, condoms, or pills. All the information I just gave you, were you able to understand? You must take care of these things so that both the mother and child remain healthy.
Thank you.
Let us discuss whatever we have seen in the film till now. Your trainer will help you in this. What examinations are to be done during antenatal visits? How do you calculate expected date of delivery, EDD? What's the name of the pregnant woman? What can we learn through abdominal palpation? How to correlate fundal height with gestational age? Counselling during pregnancy should focus on: what are the messages about the posters on the wall? Let's discuss. Let us repeat the main messages of the film. Accurate EDD helps in birth preparedness. Eliciting a good history ensures better antenatal care. Abdominal palpation helps to monitor fetal well-being and growth. Appropriate counseling helps a pregnant woman to take care of herself.